Hi, everyone. Thanks for joining us today to go over the 2026 NextBlue Advantage Plan updates. Before we begin, we do just want to say thank you for your continued trust, business, and your patience during this busy Medicare season. We do truly appreciate it. Before we dive into the plan information, we also want to introduce or maybe reintroduce to some of you the faces behind the team. So first on the left-hand side, we have Elaine. She's going to be one of our Part D coordinators. So she comes in this time of year to help run the prescription reviews on all those prescription medication lists that you guys get to our office for the new year to make sure all those meds are going to be covered with your company. Next to Elaine, we have Trish, who's kind of the main reason behind the Bauman Financial Office. So she's our founder, owner, head agent. She kind of does it all. She, is going to handle Medicare, health insurance, group insurance, as well as the financial and investment side as well. And then we've got Ryan in the middle. He's going to be our investment professional. So if you have any financial questions, especially this time of year, we are likely going to be, having you sit down and chat with Ryan. Next to Ryan, we've got Ashley, who is going to be another agent on the health insurance and Medicare side. She also kind of handles the phones primarily in our office. So you've likely talked with her or are likely to talk with her if you have not already. And then on the far right, we have Marcia, who is our second Part D coordinator. So same as Elaine, she comes in this time of year to help us run all of those reviews on your guys' prescriptions. All right, jumping over to our content. So again, we will be going over the 2026 NextBlue Advantage plan information for the state of North Dakota. If you are a current NextBlue member, you should have received correspondence from NextBlue. And if you have not already, you will likely be getting so very soon. Notice that the plan you are on, if you are on the classic plan or the premium plan, so the $0 monthly plan or the $73 monthly plan, those two plans are ending at the end of 2025. So if you are on the classic plan or the premium plan, you will need to sit down or chat with someone from our office at some point during this fall to find some new coverage for 2026. NextBlue does have a third option. It is called the Freedom Plan, which is going to be seen on the far right-hand side of the screen. So it is a medical only plan. It does not include your prescription insurance. If you are on the Freedom Plan, this one is not going away. So you do not have to make a change if you have been happy with that plan. Again, the classic plan or the $0 plan and the $73 plan, also known as the premium plan, are ending at the end of 2025. NextBlue as a company is not going anywhere. They will be introducing two new plans, the Discover plan on the left-hand side of the screen and the Summit plan, which is going to be that middle column. So if you have been happy with NextBlue and you want to stick with them as a company, you will have some new options going into 2026. So we're just going to kind of dive into the content here. We'll start with the Discover plan. So that plan on the left here. So it is known as the Discover plan. It will have a monthly premium of $59 per month. This plan is going to have an annual medical deductible of $200. So you will have to meet that deductible, which, $200 is not much. So it should not take much to hit. The annual out-of-pocket maximum is $8,000 for the year. That out-of-pocket maximum is kind of your worst case scenario. So, if you're doing a lot of doctoring, you're paying a lot of co-pays. When and if you hit $8,000 for the year, you should be done. NextBlue, will pay for the rest of your medical visits. So going right below that first green line, your primary care visit is going to be $0 to you as the member. If you see a specialist, which really a specialist is kind of going to be anything ending in ist, cardiologist, neurologist, physical therapist, anything like that, $55 per visit. Preventative services will be a $0 copay to the member. Inpatient hospital care, days 1 through 4, will be a $450 copay per day. Once you hit day 5 and beyond, it is a $0 copay. Skilled nursing facility, so that's going to be temporary, not if you're moving in long term, but a temporary stay, maybe for some rehab or something. You will have $0 copays for days 1 through 20, and then a $200 copay per day for days 21 through 55. After day 55, anything up and beyond that through day 100 will go back down to $0 per day. Outpatient surgery will have a charge of $450 to $550 per surgery. The range is probably going to be due to where you're having the surgery. So, what kind of facility, if it's a surgical center versus a hospital, or maybe even just the type of surgery that you are having. Diabetic supplies should be a $0 copay for monitoring supplies. Home health care will also be a $0 copay to you as the member. Diagnostic radiology services. So these are going to be things such as MRIs, CTs, scans, ultrasounds, stuff like that. Also, depending on the type of scan you're having, has a range of $0 to $200 per scan. Lab services is a copay of $20 per lab. Copay for outpatient x-rays is $25 per x-ray. There is emergency ambulance care. So if you are transported by the ground ambulance, it is $350 to you as the member. And if you are transported by air, it is a 20% of the overall cost charged to you as the member. Emergency care, it is a $115 copay, but it is waived if you are admitted within a 24-hour period. Urgent care visits are going to be $40 per visit, so walk-in clinics. Next, we're going to jump over to the white column, that middle one, the Summit Plan. So this one carries a monthly premium of $149 per month, and it does not have a medical deductible. Your annual out-of-pocket maximum will be $6,750, and your primary care visit will also be a $0 copay to you as the member. Specialist visits are going to be $45 per visit. Again, anything ending in ist is generally a specialist. Preventative services are a $0 copay. Your inpatient hospital care, so anything, again, we're hospitalized, is going to be a $425 copay per day for days 1 through 4, and anything after that will be a $0 copay. Skilled nursing facility, again, this is a temporary stay. $0 copay for days 1 through 20, and a $200 copay per day for days 21 through 55, and anything between day 56 to 100 will be a $0 copay again. Outpatient surgery will have a range of $350 to $400. Again, it will vary depending on where you're having the surgery or maybe the specific type of surgery you're having. Diabetic supplies on the Summit Plan are also $0 for monitoring supplies. Home health care, again, will be a $0 copay to you as the member. Diagnostic radiology services, so the different types of scans, again, has a range of $0 to $175. Lab services are going to be $10 per lab, and outpatient x-rays are $20 per x-ray. Ambulance will be $250 if you are transported by ground ambulance, and a 20% charge to you as the member if you are transported by air ambulance. Emergency care with the Summit Plan is $125 copay, but it is waived if you are admitted within that 24-hour period. Urgent care will also have a charge of $50 per visit. So again, walk-in clinics. The Freedom Plan on the far right-hand side. So this plan, again, does not include prescription drug insurance. So if you are someone who does need that prescription insurance, this is not the plan for you. It's designed for people who have prescription coverage outside of Medicare. So maybe like a veteran who has their pharmacy or prescription benefit administered through the VA. It will only cover doctor visits. So this one carries a monthly premium of $0. So again, not paying anything per month. It also has a medical deductible of nothing. Your annual out-of-pocket maximum with this particular plan is $6,500 for the year. Primary care visits are $0 with this plan, and specialist visits are $50 per visit. Preventative services are nothing, or $0 to you as the member. Inpatient hospital stays are $425 per day for days 1 through 4. And after day 4, so day 5 and beyond, is going to be a $0 copay per day. Skilled nursing facility, again, a temporary stay, $0 copay for days 1 through 20, and a $200 copay per day for days 21 through 55. Anything between day 56 to day 100 will be a copay of $0 per day once again. Outpatient surgery will have a range of $350 to $400. Again, depends on where you're having the surgery or maybe the particular type of surgery you are having. Diabetic supplies, the monitoring supplies are again $0 copay for the member, as well as home health care will also have a $0 copay. Diagnostic radiology services will have a range of $0 to $125. So again, depending on the type of scan that you are having. And lab services will be $10 per draw. Outpatient x-rays are $20 per service with the Freedom Plan. And your emergency ambulance coverage is $250 for ground ambulance and 20% for air ambulance. Emergency room care is $125 copay, but that is also waived if you are admitted within that 24-hour period. Urgent care services, again, walk-in clinics, $50 per visit. We will jump to the next page here. We're going to start it back at the top. So the left-hand column right here, Discover, middle will be the Summit, and the far right will be the Freedom Plan. So the Discover plan is going to be that lower plan at $59 a month, and the Summit plan, that middle plan, is $149. So this top section here is going to be talking about the prescription drug side of the plan. You can see at the top there, it does say the retail. So anything where you are, probably filling at a local pharmacy, is going to be the first number you see before the slash, 30-day supply. And then if you are doing a mail order or a 100-day supply, that will be the second number behind the slash. So we'll talk about the Discover plan pricing first. For Tier 1 preferred generics, whether you are doing a retail or mail order, your preferred generics should be a $0 copay to you as the member. Your Tier 2 medications, or the generics, for retail pharmacy will be $3 per fill, and your mail order will be $7.50 per fill. Your Tier 3 or preferred brand medications, whether you are getting in-store at a retail pharmacy or through the mail, will have a copay of 20% of the overall cost of that medication. That is your responsibility as the member. The Tier 4 or non-preferred medications, 25% for both retail and mail order. Tier 5 or your specialty tier medications, It's going to have a 29% copay for a 30-day supply only. Your vaccines should have a $0 copay. And then you can see below that there is an annual prescription deductible, which is going to be $300 for the Discover plan, but it only applies to tiers 3 through 5. So if you only have tiers 1 and 2, the deductible will not apply to you. And then insulin purchased with the Discover plan is $35 for a monthly supply or $105 for a 100-day supply through the mail. Looking at that middle column, the Summit plan, Tier 1 preferred generics are also $0 copay for both a retail 30-day supply or a mail order 100-day supply. Tier 2 generic medications will be $3 copay for a 30-day supply and a $7.50 copay for a 100-day supply. Tier 3 or your preferred brands, 20%, whether it is retail 30-day supply or mail order 100-day supply, as well as your Tier 4 or non-preferred drugs, 25%, whether it's retail or mail order. Your Tier 5, your specialty tier medications, again, 29%, and it comes in a 30-day supply only. Vaccines are also $0 with this particular plan. And your annual prescription deductible is going to be the same with this plan as it was for the Summit, or excuse me, for the Discover. So it is $300 for tiers 3 through 5. And your insulin is also $35 for a 30-day supply or $105 for a 100-day supply. Looking at that far right column, again, Freedom Plan is medical benefit only, so no prescription insurance included on this plan. You can see by vaccines here, it does say $0, but then Part B only. So a Part B medication, Part B is in boy. That is going to be anything that is administered by a healthcare professional. So it will include coverage on that end, but not any, injections where we pick up at the pharmacy and give ourselves at home, and also no pill insurance, if you will. So no prescription medication insurance. Now we're going to look kind of towards the middle of the page at this second thicker blue bar where it talks about the extra benefits and features. So again, starting at the left column, we can see the dental benefit. There's a flex card of $500 annually. It's a $500 annual allowance for your dental, eyewear, and hearing benefits combined. So NextBlue will send you a prepaid card, kind of like a debit card or a gift card, if you will. It's going to have that $500 preloaded on there. You will go to the dentist, the eye doctor, the hearing clinic, and you will have $500 to spend between the three of them. So you will swipe that card. If you spend all 500 at one place, that's it for the year. Or, you can try to break it up between the three. It is your choice, but $500 for the year for all three areas. You can see there is no over-the-counter allowance in 2026 with the Discover plan. Vision benefit, again, $500 annual allowance comes on that card for dental, eyewear, and hearing combined. But your routine eye exam once per year at an in-network provider should be covered at no cost to you as the member, as well as glaucoma screening should be covered at no cost to you. Again, that hearing benefit, $500 combined for the three different buckets, or dental, vision, and hearing for the year. There is no fitness benefit included with the Discover plan for 2026, and any routine chiropractic care in-network, there are limitations on what is considered routine or Medicare covered service, but it is $45 per service, again, as long as it's an in-network and a Medicare covered service. The Personal Emergency Response System, also known as PERS, is not included with the Discover plan. And then you can see across the bottom, there's rewards. So you can earn rewards such as gift cards or incentives through the Live Healthy Blue program. Going to the middle column, that white column, the Summit plan, jumping down to the extra benefits and features, same thing. They are going to have a prepaid like debit card, gift card, which will have $650 on for the Summit plan. So again, $650 for the whole year, and that is to spend between dental, vision, and hearing. You can spend it all on one if you want, or you can break it amongst the three categories, but it is one amount for all three of those. Your vision benefits also includes the routine eye exam and glaucoma screening once per year at an in-network provider at no cost to the member. No fitness benefit with the Summit plan either. And then routine chiropractic care, again, as long as it is a Medicare covered service at an in-network provider, it should be a $30 copay to you as the member. The Summit plan does include the Personal Emergency Response System, also known as PERS. So it is I think it comes as two different options. One is a pendant. I think the second one might be a bracelet, where essentially it's it's like a life alert. So if you have a fall, you can push that button and call for help. It'll connect you with someone who will, talk to you, ask you if you're okay, if you need some help, and then it can also notify, your emergency contacts as well. I believe it also has a sensor in there, so it can detect a fall even without pushing the button, I believe. So that is included in that Summit plan. And again, you can earn rewards through the Live Healthy Blue program with the Summit plan. The far right column, the freedom only, or excuse me, freedom or medical benefit only plan. Again, they have that flex card with the $650 annual allowance for dental, hearing, and eyewear combined. With the freedom plan, you do get a $50 quarterly allowance for any over-the-counter products. You can purchase them through NextBlue's app. So it's going to include things, vitamins, Band-Aids. I think there might be some equipment such as like thermometers and stuff on there. Lots of great products you can browse. And that is quarterly. So you get $50 four different times a year to spend on those products. And it is a use it or lose it in that quarter. So if you don't spend that $50 in the first quarter, you don't get 100 in the second quarter. You only get, the $50 that is allotted for that second quarter. So in total, $200 for the year, but you do have to spend it quarterly with the max being $50 per quarter. Your vision at an in-network provider, again, routine eye exam once per year, as well as glaucoma screening is going to be covered at $0 to you as the member. Hearing benefits through Nations Benefits. And I'm going to back up because this is going to be the same between the Discover, the Summit, and the Freedom Plan. I think I missed noting this. Your routine hearing exam once per year is covered at no cost to you as the member across all three plans. Like I said, through Nations Hearing. And then the Freedom Plan does include $100 annually towards a fitness or gym membership. So you get $650 to spend again between the dental, eyewear, and hearing, but then there will also be a separate $100 on that card that you can use towards a gym membership, at a facility of your choice. And then again, there is routine chiropractic care coverage, has to be a Medicare covered service at a network provider. And then it will be a $30 copay to you as the member. And the Personal Emergency Response System, also known as PERS, is also included with this plan. And again, the Live Healthy Blue program available to members to earn rewards through. I believe that covers all of our content. So again, if you are a current NextBlue member on the classic plan or the premium plan, you do need to make a change for the new year as those plans will not be offered in 2026. NextBlue, again, like we just went over, as a company, will still be around. They've got new options to choose from. If you've got questions or would like to sit down in person, please give us a call at 258-6644. Otherwise, if you have mailed in a list of your prescription medications to our office, someone from our team should be reaching out over the next few weeks to go over those results with you. Again, if you have any questions, please give us a call at 258-6644. Thank you for joining us today.